Good afternoon and welcome everyone to the webinar on seniors bullying, what is happening in Ontario prevalence study. I'm joined here today by Kirsten Madsen with Sheridan College and Lisa Francis with Sheridan College. So just some housekeeping. All attendees will be muted throughout the webinar. The session is being recorded, and the recording and PDF copy of the slides will be posted on the Elder Abuse Ontario website under Training, under Webinars. If you are experiencing any technical issues, please type it into the chat box and send to Mary Mead/Rochella. If you have questions, we will take the remaining 15 to 20 minutes at the end of the presentation, and we will take up those questions at that time. So if you have a question concerning the webinar, please type that in the question box. At the end of the session, you're going to be prompted to fill out an evaluation form. If you're not able to complete it at that time, you will also receive an email with a link to the evaluation. And the evaluation is essential for us to be able to look at the topics as well as the speakers for future webinars. The contact information for Kirsten and Lisa will be provided in the PDF copy of the slides. And for those of you who like to take notes, if you go to the toolbar on the right-hand side, if you click on handouts, you will be able to actually download the PDF copy right now, and you can print it and take notes as we go along. So just before we get started, I'd like to do a land acknowledgement. So in the spirit of truth and reconciliation, we would like to acknowledge the many territories of Turtle Island, Canada, on which we work and reside, by acknowledging that we are meeting on Aboriginal land that has been inhabited by Indigenous peoples from the beginning. As settlers, we're grateful for the opportunity to meet here, and we thank all the generations of people who have taken care of this land for thousands of years. Long before today, as we gather here, there have been many Aboriginal peoples who have been the stewards of this place. We recognize and deeply appreciate their historic connection to this place. We also recognize contributions of Métis, Inuit, and other Indigenous peoples have made, both in shaping and strengthening this community in particular, and our province and country as a whole. Land acknowledgements do not exist in a past tense or historical context. Colonialism is a current, ongoing process, and we need to build our mindfulness of its present participation. As settlers, we recognize this contribution and importance of Indigenous peoples must also be clearly and overtly connected to our collective commitment to make the promise and the challenge of truth and reconciliation real in our communities, and in particular to bring justice for murdered and missing Indigenous women, girls, trans, and two-spirited folks across our country. Elder Abuse Ontario is a not-for-profit organization. We do receive funding through the province of Ontario, and we're governed by the Ministry of Seniors and Accessibility. And we oversee the implementation of the Ontario strategy to combat elder abuse. Our mission is very simple. It's to create an Ontario where all older adults are free from abuse and neglect and are safe and respected. And while we are funded by the province of Ontario, we do not necessarily reflect the views of the province. The Ontario strategy to combat elder abuse was put in place in 2002. It encompasses community coordination and response, frontline training, public awareness, and research and evidence. We have 7 regional consultants across the province. We have consultants from our Francophone community, we have Stephanie based out of Ottawa and Jose based out of Sudbury. And our primary role is to develop resources and training modules to provide training to frontline service providers and to older adults in the community. We also work in partnership with our 40 elder abuse networks across the province. We are not a health service provider, which means we cannot actively investigate or intervene in cases of elder abuse. So we cannot provide that case management type role. But we do provide consultation to service providers who are providing direct service. So I'd like to introduce our two speakers. We have Kirsten, who has been a faculty member at Sheridan College, and she received her PhD in developmental psychology from the University of Sheffield and in England, and specifically her graduate work was with the Sheffield University Anti-Bullying project. Since then, she went on to assess what anti-bullying strategies are being implemented by schools across England. Kirsten conducts research and has done extensive training with frontline staff in the area of bullying, aggression, age differences, gender differences, and program development. Currently, she is the project director for the Seniors to Senior Bullying Project, what is happening in Ontario, a project that is being conducted in partnership between Sheridan College and Elder Abuse Ontario, and is being funded by the Social Sciences and Humanities Council of Canada grant. And then we have Lisa Francis. And Lisa is an older adult advocate that has worked with diverse older adult communities in Toronto and North York. Her background ranges from working with older adults in long-term care to adult day programs and managing a multicultural seniors active living center. Lisa's education includes a health and society degree from York University and a diploma from George Brown College in Activation, Coordination, and Gerontology program. Lisa is passionate about advocating on behalf of older adults and ensuring that they are consulted and engaged in matters that help them stay independent in their homes and engaged in their communities. So without further ado, I'm going to pass it on to our two speakers. And we have here with us Kirsten and Lisa.
Thank you, Rochella, for the kind introduction, and welcome everybody to the Senior Bullying, What is Happening in Ontario Prevalent Study webinar. Today's objective, so the next slide, please. Today's objectives are that we're going to be giving you a project overview so that you know exactly what the project entails, some demographic representation of those people who had kindly and graciously completed surveys, our preliminary statistics, which are based on SurveyMonkey at the moment. We will be entering them into a more complex system, so SPSS, and being able in future updates to be able to give you more with regard to the statistics itself. We'll also be discussing next steps, and there will be a question and answer period at the time. But before I get into the project itself, I wanted to just give you an introduction to the team, because a project like this can't be done in isolation. There's a huge team involved, and fortunately, everybody's connected to the webinar at the time. Many of the people are actually in the room with me from Sheridan College, so it's myself, it's Lisa Francis. There's Catherine Warren Norton from the Sheridan Center for Elder Research. There's Jordan Souza. There's Rebecca Rodriguez. They're both research assistants and students here at Sheridan. From Elder Abuse Ontario, we have Rochella Vassell, Rayanne Rideout, and Stephanie Cadu. And we can't forget Patricia Spadafora, so Pat Spadafora, and she is from Kaleidoscope Consulting, And she is the person that's responsible for really getting us all together with regard to this project. Now, before we begin with regard to the project itself, it's really clear that everybody has an understanding with regard to how we're defining seniors bullying and what was being surveyed. So you'll notice in the next slide that, in fact, the definition that we have is bullying is sometimes called harassment and happens when someone hurts, intimidates, or scares a peer consciously or unconsciously. When someone is being bullied, they often have a hard time defending themselves. Bullying is usually not a one-time event. It can happen over and over again. And you will notice that, in fact, an emphasis of this is that the focus is on the behavior and not on people such as bullies or victims, but rather the behavior itself. What we're looking at is peer-to-peer. So this survey relates to bullying, which is based on peer-to-peer interactions and not perpetuated by a person who is in a position of trust. So we're doing that to differentiate from the abuse element. Now, that said, that there was a strong recognition that people may complete a survey and in turn realize that they are being abused. And as such, at the bottom of our survey, we included the senior safety line. Also, if it's an emergency, 911, and a reminder just that reporting abuse is mandatory in long-term care and retirement homes. So with that said, I'm going to move on to the project aims itself. You'll notice that in the past, there's been a lot, the research is really focused in the United States with some work that was done, in fact, in residences. In fact, primarily, the research to date has been collected in residences. That said, Bonnie Cutchin from Ottawa got a New Horizons grant and was able to conduct the first survey here with 85 participants. And she's been very generous with regard to her sharing her knowledge from that with our team. So with that said, in order to actually combat and deal with bullying, perhaps combat's not the correct word, but rather deal with bullying itself and preventing it and intervening, we really had to engage in an implementation science process. So that involves getting an understanding for actually what is happening and what bullying looks like in Ontario. So as such, the first stage was to collect data on the prevalence and the nature of senior-to-senior bullying in Ontario. And this is what's incredibly important as well is previous surveys conducted focused on residential settings. But as my dear colleague Pat Spatafor always says, it's really important to look at the community. And as such, that's where we targeted the community as well. So older adults who not only are living in seniors' residence or apartments, but also people living in the community itself. Now, we've completed the data collection period, and now we're moving on to analysis. You'll notice from the previous slide that the next part of the aim of the project is to use this data to create a resource pack outlining best practices for seniors and those working with seniors to stop bullying itself. So that part will be where we'll be engaging in the implementation science process to address it. We really need a clear understanding of what we're dealing with. Now, the surveys themselves, which the survey questions on the next slide, really focused in on how prevalent is bullying behavior among older adults in Ontario. When we're talking about older adults, we were targeting people 55 and over. What types of behaviors are occurring? What the typical profile is of a person who is bullied and that of a person who is engaging in bullying. We needed to get a better understanding of the reasons behind bullying and the perceived consequences themselves. It's a very lengthy survey, and it was done in order to collect data that is essential with regard to developing prevention and intervention programs. The survey itself was designed in consultation with PrevNet, so particularly Deborah Pepler. Bonnie McCutcheon was able to share a great deal of knowledge. Her, as I said, the survey she conducted was the Carlington Senior Bullying Survey, and it was a New Horizons grant. And based on that, together, the team from Sheridan and Elder Abuse Ontario, we developed a survey in order to tap into and to extract important data that we would need to turn into something that is more tangible and that we can use with regard to a resource package. The survey itself, as I said, it targeted older adults, 55 plus, and we went through the internet and also senior centers across Ontario. We were looking at people living in the community as well as in seniors' residences. To date, no one has looked at people in the community, and we've had 88% of our respondents were there. But Lisa will speak more to that point. Our geographic regions are rural and urban, so we tried to get a better representation of the entire province. Also, from a language perspective, the surveys were available in English and French. In addition to the 5 languages on Ontario as identified by the Ontario government, which is Punjabi, specifically Indian Punjabi, simplified Chinese, Portuguese, Italian, and Spanish. And we had an online version plus a paper version. A lot of work was done on the paper version, and Lisa, Rebecca, and Jordan were astronomical with regard to the effort that they put in. They mailed out 1,150 English surveys with only 131 being returned. But that said, many of the participants who did complete the paper survey said they were very grateful that there was a paper survey. So I hope that my colleagues are in agreement that it was worthwhile to do that. Now, that said, the respondents themselves.
So I'll take over. Hi, everybody. I hope you're all having a great morning. So in terms of who has actually responded to the survey, what is the data showing? So our N here, so our total number of respondents with both online and hard copy, as well as all of the languages combined, is 683. So 683 completed the surveys. Today, what we're going to be focusing on is the English completed surveys, and those were 653 surveys that were completed. The other ones, just for your own information, out of the different languages, we had 13 that were completed in French, 1 in Chinese, 2 in Spanish, and 14 in Punjabi. Unfortunately, we didn't have any respondents who responded in Italian or Portuguese, but that's okay. We tried our best. One little special note that I wanted to highlight is we just definitely wanted to thank each and every older adult who took the time to complete the surveys, with many, many thoughtful comments, especially in the sections where we asked you to put your own personal input into the survey, as well as a very big thank you to all of the community stakeholders who helped advertise our project and encouraged your clients to complete the survey. We really thank you. There's no way we could have gotten 683 older adults doing the survey without your help. So just a very big thank you to you all. And then I'll just move on to some of the demographics and what we've learned in within the preliminary data for the English survey. So what we know is in terms of the age, the majority of the respondents who completed the survey were between the ages of 65 to 74. So 40% of the folks who completed it were in that age bracket. The next largest age bracket were those between the ages of 55 to 64. That was 28%. We had 78% of the respondents were female and 21% were male. And sort of the biggest number that we're definitely going to discuss a little later on, but that might be surprising to some of you, is that 88% of the people who completed the survey live in the community. So these are folks who live independently, whether they own their home or rent. They are not people who live in a retirement home or in a seniors living residence. The people who did live in a seniors apartment or residence made up 10% of our respondents. And just like Kirsten said a little earlier, prior bullying projects have looked at residences such as long-term care homes and assisted living buildings. And for us, we wanted to look at the problem in the community. Is there a problem in the community? So I think you'll see that there is some things that we are going to be highlighting. And one thing also to note is that we weren't actually expecting such a high level of bullying behaviors in the community as we found. And again, we'll talk about that a little bit later.
So when we talk about the demographics as well, people self-identified, those who self-identified their racial or ethnic group, 78% were white, European, North American, 7% were Asian, so East, South, Southeast, and very generously, 5% of our sample were Indigenous. Now, this is huge with regard to when we look at the 2011 National Household Survey, 4.3% of Canadian households in total identify as Indigenous. So kudos to these people. And I also must say thank you to Rochella, who brought the surveys themselves to a nation while she was doing another session there. So clearly that was very helpful. Thank you, Rochella. From a regional perspective, as we had started with, we tried to do an Ontario representation, and it does closely resemble the Ontario population distribution of 2011. So 7% of our respondents were from the north, 18% from central Ontario, 16% from eastern Ontario, 15% from western Ontario, and 43% from the GTA. So we were quite pleased with regard to the representation. Now here's on to the very exciting stuff. And we really are sitting on a gold mine. So even though it's preliminary statistics, we wanted to share it with everybody before we got into the more detailed nitty-gritty of looking at more detailed things. This is a presentation of the frequencies and the percentages. So you will see that our respondents, 57% reported that they've been bullied within the last 4 months. Now, if any of you recall from Robin Boniface's pilot study, and this study was looking at distressing behavior and coping in a resident, 20% reported bullying behavior. So this is huge. Now, the other thing, too, is that when we're talking about often, we were defining it as weekly and daily, and 13% of people had said that they're experiencing bullying on a weekly or daily basis. Now, this is incredibly huge, and clearly this supports why we're doing this, because this is 88% of our population are in communities. And one wouldn't necessarily expect it to be that high because people have the option of attending different events or workshops or groups, but clearly it's still occurring. We do need to dig deeper into this, and we will be doing that with regard to the data that we have. So we will be doing a comparison to also see what percentage of this is people who live in the community and what percentage of this who live in seniors apartments or residences, so that we have a clear understanding of exactly what's happening. Now, if you look on those who are engaging in bullying behavior, this completely took us aback, I must say, because 56% of people reported that they themselves had engaged in bullying behavior within the last 4 months. This is a lot. And also, what we're going to do, too, is we're going to be combining and looking to see how many of those people had also been bullied. So we're interested in those people who are engaging in bullying behavior, if they have also been bullied. Because Lisa, one person shared something with Lisa that really got us thinking. And this person had said to her that they engaged in bullying behaviors as a response to being bullied themselves. So clearly, this is one of the reasons why it's occurring. Also, that respondents had said that 12% of respondents said they are often engaging in bullying behavior. So on a weekly and daily basis. Now, when we talk about the next slide in relation to witness to bullying, it's consistent with the previous statistics, the idea that 55% of respondents said that they had witnessed bullying behaviors within the last 4 months, and 12% said that they'd seen it on a weekly or daily basis. Now, when we looked at the behaviors themselves and what is actually going on, we've just started to go through this and haven't gone through all the comments themselves. But what's coming up is the most prevalent behaviors are giving the silent treatment. So relational bullying. 22% of people who had been bullied identified that this was the experience. Verbal aggression, so direct verbal, name calling, teasing, insulting. Another, with regard to relational aggression, they try to manipulate you by making you feel guilty. So manipulation tactics at 21%. And direct verbal came in next, again, with use sarcasm to insult you. So 17%. When we asked people how it made them feel, 70% said it was upsetting or extremely upsetting. And engaging in bullying behaviors also, 78%. So 70% of people said that when they were being bullied, it was upsetting or extremely upsetting. Yet 78% of people said and had reported that when they engaged in bullying behavior, it was upsetting or extremely upsetting. This is huge. And clearly something that is clear that we have to support people with regard to alternative behaviors. How does it make you feel? Witnessing bullying behavior itself, 45% of people said it made them angry, and 18% worried it would happen to them. A quote that really highlights this is, "I would like to stand up for the person, but I know I would be the next one to be bullied." That was written on one of the surveys. When we dug into the reasons why people feel that it happens, the number one reason identified for why they believe they are being bullied is ageism. So 27% of people identified this, and 8% said that was why they engaged in that behavior. Now, one of the examples from an age perspective was where one person had disclosed that they were being bullied because they were younger than anybody else in the seniors' apartment. Also, after age, it was followed by physical ability, race, ethnic origin, gender, and religion. So ability was 23%, race 16%, religion 8%, and gender 13%. Now, of note, 11% of participants felt their sexual orientation was the reason for being bullied, but only 2% said they engaged in bullying behavior because of sexual orientation. So clearly that's something we'd need to look at in greater depth. And further, we do need to dig deeper with regard to the reasons themselves. One of the comments that somebody provided was that they tend to see bullying at social gatherings, i.e. bridge games. Individuals take on the leader role and exhibit bullying behaviors when others don't do things as they would. In fact, there was a fair bit with regard to the characteristics of the situation that came up as themes. So this is something that we'll need to dig into deeper in order to develop prevention.
Okay, so where are we now in terms of this data? Where are we headed with it? So what we are doing right now, and we're going to be doing for the next number of weeks, is we're going to be doing some in-depth analysis with the complete data set, so all of the languages. We also are going to be updating the results on the Senior Bullying Project website, which you'll see at the end of the presentation, as well as it will be updated on the Elder Abuse Ontario website. What we want to do is we want to start looking more at what the results are yielding, as well as looking at more relational results, like Kirsten was talking about. Do women tend to experience or engage in different bullying behaviors as compared to men, for example? Do the different cultural groups who have completed the surveys have different trends that we're going to see with them versus the English-speaking respondents? That's what we're going to be looking for and analyzing in the next number of weeks. And here is, again, just another respondent saying, everyone knows this is happening. We need answers now. And if you're tuning in, you too most likely know, yes, bullying between older adults is happening, and this is what we're doing, is we're trying to get those answers now with this project. We know that older adults see it as a problem and professionals want answers, right? So in terms of the application of the data, what is going to happen next year, so spring and summer of 2019, we are going to host 4 think tank sessions. So one is going to be in the GTA and Halton region, Peel region, Southwest, Southeast, and East. Sorry, I should clarify. The first one is going to be in Oakville, so that includes GTA, Halton, and Peel region, just to be clear. We are going to host these think tank sessions with stakeholders across Ontario to obtain feedback on the data. And for us, stakeholder mean older adults as well as professionals who work in the industry. So if you work for an active living center and you have older adults who serve on your board of directors or on your members council, or someone who's just very interested in this, we are absolutely inviting them to these sessions, and we need to hear from them as well. So when we develop our poster and we send that out to you later this year, please feel free to post it on your community boards. These are sessions that are open to anyone. We will then use the data and the feedback to develop a resource package of best practices for older adults, frontline staff, and agencies to use in order to prevent and respond to bullying. So again, if you're interested, the website will have all the updates. I also have an email list of stakeholders who have told us we'd like to be invited. You'll see my email at the end of the presentation if you are very keen on attending one of those 4 sessions, either in Oakville, London, Peterborough, or Ottawa. Please feel free to send me an email. And then in terms of the think tank sessions themselves, what we're going to be focusing on is presenting the final data. What we're presenting today is the preliminary data because we haven't run it through our extensive statistical database. So we're going to be doing that. And we want to engage people who come to these sessions and exercises to obtain your stakeholder feedback on the data itself. Is it something that you are seeing happening? Maybe not so much, maybe a variation of it. And we also want to obtain feedback to inform prevention and intervention strategies because we want to stop bullying behavior amongst older adults. So one of the things to note is these think tank sessions are not training sessions. So you will not come to the session and learn different strategies on how to prevent bullying. We are not there yet. These are sessions where we want you to come out, engage with us about the data itself, what you're experiencing, to then help inform what will be the resource package. And anybody who attends, we will be assigning a very small homework portion to the think tank session. You're going to know about it well ahead of time, so we're not going to send it a day before. And the homework will assist us in the think tank sessions in terms of splitting everybody up into smaller groups. So that way, if there are people who work for similar agencies or older adults who've experienced similar things, they might be breaking out into smaller groups together to work with our facilitators, or we might use that information to split everybody up so we hear a diverse array of feedback. And what we're looking at in terms of timelines is late April and May 2019. So if you've given me your email and you haven't heard from me, don't panic. It's just that we do have quite a bit of work ahead of us before we do the sessions. But again, if you'd like to just double check that you are on my list, feel free to send an email. And then finally, what's the ultimate objective? So we want to use this survey data, your stakeholder feedback, and evidence-based preventions and interventions to develop a resource package. We want to make a package that is really comprehensive and is actually using the data in terms of what is happening in Ontario. And in the meantime, the survey asked, what would help you address bullying behavior? I like this spinning action. So the two main responses that we heard again and again is that people want education and awareness, and they want to speak out against it. So I wanted to have you, if you're thinking of joining us for one of the think tank sessions, I want you yourself to think, what would help address bullying behavior in your workplace, maybe in your home, maybe at your senior center, because that's going to be one of the large overlaying questions that we're going to be discussing. And again, we see it in what some of the respondents said, speaking out against it and reporting it whenever seen or heard. So when we ask, what would help you is, well, if we speak out against it and we report it. And then to sign up for the think tank sessions or to see some of our project updates, please feel free to visit the Senior Bullying Project website. As you can see it listed, it's at sheridancollege.ca/research/active research/circ/bullying between older adults. It's a mouthful. And again, if you have any information that you would like either myself or Kirsten to respond to, those are our email addresses here on the slide. And I also wanted to let you know that we do have a general email, which is senior.bullyingproject@sheridancollege.ca. And again, all of those emails get checked at least once a day. Okay? So please feel free to reach out to ourselves in the next coming weeks.
Great. Thank you, Kirsten and Lisa, for your presentation. We're actually done a little bit earlier than normal, and that's because you were very concise in your presentation. So just a reminder to all of the participants, if you go to the toolbar on the right-hand side and you click on handouts, you can actually download the PDF copy of the slides. This is also a reminder, and Kirsten alluded to this earlier in her presentation, that service providers, older adults, people that are concerned in the community, they can call the Senior Safety Line. The Senior Safety Line is available 24 hours a day, 7 days a week, in 150 languages. So callers can, call and speak with a trained counselor anonymously, and they can provide information, referral, safety planning, and psychosocial support over the phone to people who are calling. And this is a partnership that we have with the Assaulted Women's Helpline, which manages the Senior Safety Line. If you want to stay connected to us, you want to find out about our conferences, our webinars, our newsletters, please go to our website. It's www.elderabuseontario.com. And when you go to the homepage, you just click subscribe to our newsletter, and you will automatically be added to our constant contact list, and you will start to receive updates. Our website is completely bilingual. If you go to our website, we have information on upcoming training events, elder abuse intervention modules, a directory of programs and services, as well as there are fact sheets and handouts for older adults. We also co-developed recently a new Elder Abuse and Knowing Your Legal Rights brochure in partnership with the Advocacy Center for the Elderly. And we are currently offering training to people who are interested in learning a little bit more about legislation, mandatory reporting, statutory guardianship. So in order to obtain a hard copy of this resource, you would actually need to attend a webinar or training session, and we will continue to host those across the province. If you wanted to host an in-person session, you can connect with your regional consultant in your area. And so, as Kirsten mentioned, there's myself, Rochelle Vassal, Ran Rideout, and Stephanie Cadu, who are the research, consultants on this project. And we have both Stephanie and Rayanne here on the line. We are currently looking at venues. So for those of you that are online, if you have a large venue that could accommodate 40 people, that you can offer complimentary, because with any type of research grant, there's only so much that we can allocate to venues. Please do connect with us, and we'd like to look into those venues. So thank you for attending the session. As I mentioned, the slides are in the handout section. I'm going to go back to the contact slide for Lisa and Kirsten, and then we're going to open it up now to questions. So there's a comment here. Please have a think tank session in French in the Ottawa region. Work with Farfo. Work with Farfo with this. It's a great subject for discussion. So,
can I address this, please?
Sure.
So one of the things that we wanted to bring up is not only with regard to Ottawa, so there won't be a separate think tank in French, but rather we're in a fortunate position that Stephanie is bilingual in French and English, and she's graciously said that she would be at all 4 of the think tanks. So as such, there won't only be French representation in Ottawa, but also for those people in Oakville who would be attending in Oakville, in London, and in Peterborough as well.
Perfect. Thank you for addressing that. And Stephanie, you're also on the line, and you are doing some work with Farfo.
I am, yeah. We are currently looking at establishing a provincial network who will be looking at and addressing the issue of elder abuse in their communities.
Perfect. Thank you, Stephanie. So there's a question here. Who do we report senior bullying to in the community when it always occurs without a witness? So thank you for that question, because that was one of the things that we look at in terms of the consultants who go out and deliver seniors bullying presentations. So in all of our long-term care homes and retirement homes, there's mandatory reporting around abuse, which also ties in bullying. So we have those safeguards. So for the long-term care homes, it's section 24, and we're reporting to the Ministry of Health and Long-Term Care. For the retirement homes, it's Section 75 of the Retirement Homes Act, and we're reporting to the Retirement Homes Regulatory Authority. But in the community, it depends on if it's criminal or not criminal. And so when I go out and I do seniors bullying presentations, I usually do it in conjunction with a senior support officer or a vulnerable persons coordinator. So if there's something criminal in nature where, for example, let's say it was verbal bullying between 2 older adults and somebody threatened bodily harm, that could be considered a criminal offense under uttering threats of the Criminal Code of Canada. Or if they actually assaulted the person or they damaged their property. But you're right in terms of the fact that they need proof. So they need to notify the police, and they need to have some sort of evidence for the police to conduct their investigation. Now, in some cases, it is bullying behavior. As Kirsten mentioned, teasing, name calling, that might not be criminal in nature. And that's why we're really looking at hosting these think tank sessions to look at, where is the bullying occurring? So let's say it's occurring in an older adult building. Let's say it's a Toronto community housing building, for example, and they have community relation workers who are supposed to be working with residents, in those specific older adult buildings. So the community relations worker would receive a complaint about bullying, for example, but they need to have that complaint in writing, and they need to know who the parties are, which sometimes, can be hard if the person is fearful of making a written complaint, as well as, there might be only so much that they can do. So sometimes the person that's experiencing the bullying wants the person who's exhibiting bullying behaviors to be evicted from the building. But that's not that's not an easy process. That process has to go through a tribunal. There needs to be evidence to support it, as well as many of the buildings don't have zero tolerance policies around the bullying. So that's why we really needed to do the research, because we wanted to know what is the nature of the bullying. So if the bullying is around ageism or racism or ableism, then we could do some education around those isms, about people's rights under the Ontario Human Rights Code, and as well as look at developing some zero tolerance policies that the agency, so the housing, TCHC, for example, could put in place. So that way they actually have a framework in terms of letting people know what's acceptable behavior and what is unacceptable.
Sorry, Rochella. I just wanted to interject quickly with regards to the idea of us developing policies. This is where we have to look at the previous evidence from previous projects themselves. And it's really one of the most overwhelming results from international projects that looked at tackling bullying issues was policies, but not policies that were handed to schools or places of employment, but rather are developed by the people themselves who are at those agencies or community centers or seniors residences. And that would be an area that we would be discussing with regard to how to go about the process of actually developing a policy itself so that there's templates in place. And also, overwhelmingly, the research indicates that the majority of reductions in bullying actually happens while policies are being developed. So I'm sorry, Rochelle, I just wanted to interject on that one so that people didn't think it would just be handed to them. It's something that would actually require a process.
Absolutely. So yes, so I hope that answers your question. There's another question here. How do you educate a boss that what they are doing to you is bullying? This boss was horribly bullied by his father as a child and has nothing to do with him as an adult. So I think the question is, what do you do about your boss that's bullying you, which would constitute workplace harassment, right? Bill 168. I don't know, Kirsten, if you have more information on that, or Lisa?
Yes, there's extensive research that's been done in the area of workplace bullying, and oftentimes what ends up happening is the person who's engaging in the bullying behavior sees the person they're targeting as a threat. That somehow that person's skill set or that their whatever it is that threatens their position. So, and the behavior itself is also oftentimes what you see is the behavior is also a type of a form of relational bullying, whereby people, and this becomes harder. So if it's very straightforward, where the person is engaging in direct verbal and harassment, then that can be reported. And it's best to also chronicle exactly what's happening so that there's that you have a written report of when it happened and what happened, and if there's any witnesses involved. But that said, there's also a form of bullying that you often see in the workplace, and that's relational bullying, where people are targeting your work. They're overworking you, and they're criticizing your work. And they're not criticizing your work in a way that it will enhance it and make it better, but rather it's in order to hurt you. That is a lot more difficult to get a handle on. But again, if people are chronicling and are able to be really clear as to what is being asked of them and what has happened, then they have a case to go forward to their supervisor. And I would strongly recommend that they do that.
Great, thank you. There's another
Yes,
question
and
here.
specifically, I did forget with regard to HR that you would go to.
Great. So there's another question here. Curious if seniors living in low-income social housing were surveyed.
Yes, they were. The surveys went out to any and every stakeholder that we could find in Ontario. So we sent out surveys to all of the active living centres in Ontario. We sent it to retirement homes, seniors apartments, and because it is all voluntary, if they wanted to participate and complete a survey, they did. For the most part, what I know that a lot of assisted living buildings and retirement homes did was they put up a poster of the survey, and folks were able to do it on their own. And if there was those who specifically asked that we mail out surveys to them, we did that as well.
Great. Thanks, Lisa. There's another question here. Is there a way to redirect seniors from bullying without having them become defensive, thus escalating the issue?
So again, this is one of the things that we're looking at with regard to how it's going to be done in order to have that as a resource pack for prevention, but also intervention, because that's a very important area that we will be working towards, is the idea of how to deal with not only prevention on a large scale, but also intervention on this type of a one-on-one when it actually occurs, and supporting people who are engaging in this behavior in more appropriate ways of behaving, because clearly from the data we have seen that people who are engaging in these behaviors are also distressed by it as well. So that'll be a very important thing with regard to how it will be done.
Great. And there's another question here. Is there research being done around seniors affected by mental health and addictions who are being bullied?
No, to date, the area of, that's what I was saying earlier on, the area where people are actually engaging in research in seniors and older adults is lacking. Prior to this particular study, it was in the United States, and also there was a study that was done in Europe that was looking at bullying in relation to residents themselves, but they weren't looking at it from a cognitive. They weren't addressing cognitive issues. They actually had that as exclusionary criteria, meaning that they kept that separate, so that they were just focusing with people who are cognitively intact and the behaviors they were engaging in. But that is a very, very relevant and important area. And to date, it's not an area that's been addressed.
Great. Is teaching bystanders to intervene an effective method to discourage bullying?
Well, again, we don't know from an older adult perspective, but it's clear from the previous research with teenagers specifically and with children that it's an essential message to come across. That what we found at the Sheffield Project was that by remaining silent, you're condoning bullying. So by not speaking out against it, you're supporting it. And as such, that's something that will need, and that would need to be built into the prevention programs as well. But people need to, clearly from the comments that we've received, where people are worried that if they stand up, they will be the next person to experience it, that there has to be systems in place that they feel safe in standing up and how they would do it.
Great. And I do have two poll questions here. So the first question I'm going to start launching now is, I have witnessed older adults exhibiting bullying behavior. And you can just take the poll there. The answers are yes, no, or unsure. So we're just in the process of collecting those responses. We'll stop at 30 seconds. Okay, we had 56% that voted, and 84% said yes, 11% said no, and 5% were unsure. So I have a second question here. And the second question is, seniors bullying is an issue that I have faced in my workplace. And the answers are yes, no, or unsure. And we'll stop at 30 seconds. Okay, 67% said yes, 29% said no, and 4% are unsure. And we had 73% of the respondents voting. So thank you for providing us with that feedback. There's another question here. How much responsibility are the owners/managers of seniors' residences taking for preventing bullying? Did anyone want to respond to that?
Oh, a question. I thought
Yes,
that was
sorry. Yes, we're done with the polls. Thank you.
I'm waiting for the possible responses with great enthusiasm. So clearly, there is a call out for people to be able to do something. So we've had a lot of support from seniors residences and agencies with regard to wanting to be part of the think tanks, because they do want to do something. It's just a matter of what's to be done. In fact, we've also started to collect a list of challenges that people have presented for them to be able to do something about it. And one point speaks clearly to a question that was asked with regard to workplace bullying. And one person had called and said that they basically were amongst the staff in the agency, there was bullying going on. So what message did that send to the older adults who were attending this particular center? So clearly there's a lot of concern and people are interested in doing something, but I wouldn't be able to tell you what the percentage was with regards to all the different support people who work with older adults and their interest in actually taking responsibility for it. But clearly this shows just how much enthusiasm is in this area, that people are interested in doing something.
That's great. I'm going to go to some people that are calling in on the phone that may not be able to type questions in. So I'm just going to unmute you, Kim E. Kim, did you have any questions? Kim?
No.
Okay, perfect. I'm just checking with the people that are calling in because I know that they can't type any questions in there. Thanks, Kim. I'm going to move on to the next person. Pamela? Pamela M., did you have any questions or comments? Pam, are you there?
Yeah, I am here. I missed part of the presentation. One of the questions I was interested in, was there any response about bullying of seniors by their adult children?
Okay, thanks, Pam. I'm going to mute you again. Go ahead, Kirsten.
Hi, sorry, it's Lisa. So,
Lisa.
thank you so much for that question. That is something that we did see trending in some of the qualitative responses. So when we were asking people, is there something else you want to tell us? There was a lot of, I guess, sort of bullying within family dynamics. So whether it was adult children, or it could have been that people knew that maybe their friends' children were bullying them, or sometimes it was someone who was 55 saying, hey, my siblings are bullying my mom who's in her 70s and 80s. I think one of the things that I just want to reiterate, if you were a little bit later to the webinar today, is that the survey really was focusing on peer-to-peer bullying. So we weren't asking, if it was an adult or, if it was an adult child, for example, or if it was a person who was in a position of authority. That's the main thing that I just want to highlight, that it wasn't someone who was in a position of authority. It was peer-to-peer. But having said that, there was quite a bit of anecdotal evidence coming out of adults who were bullying their parents and friends, vice versa, anywhere. And parents bullying children too, yeah.
Great, thank you. Pam, did you have anything else to add there? Or
No, not at this point, thank you.
Okay, thanks. So I'm just going to move on to the next person here. And Shelley, did you have any questions? Shelley R. Okay, we're going to move on. And we'll go to Trudy. Trudy M. Trudy, did you have any questions or comments? Okay. I don't see any other questions. Oh, sorry. I don't see any other questions or comments here. I'd like to just, Lisa or Kirsten, do you have any final thoughts or messages?
No, it's Kirsten. I just wanted to say thank you to everyone. Again, reiterate what Lisa had said with regard to advertising the survey and supporting the survey, and those people who have also showed interest by participating in this webinar and already signing up for the think tanks. Really, without your support and input, nothing is possible. So thank you very much. And thank you so much, Rochella, for organizing this.
Thank you, Kirsten and Lisa, for your presentation today. And I'd like to thank the entire team, because I know Jordan and Rebecca and Pat and Stephanie and Rayanne, all of us have been meeting to look at what we can do. And it's a very, very exciting project, because as you mentioned, Kirsten, there's really no Canadian literature. A lot of the literature is from the States. So the fact that we're doing this project here in Ontario is very significant. And I think many of their stakeholders and older adults are really looking forward to these think tank sessions and the development of a resource package. So I'd like to thank everyone that participated in the surveys, as well as the project team. And as I mentioned, the recording and the PDF copy of the slides will be posted on the Elder Abuse Ontario website. It should be up there within a week. It just takes some time to download the recording. I will send a PDF copy of the slides to all of the registered attendees, and you can also quickly just download the slides from the toolbar under the handouts section. So I'd like to thank everyone for joining us today, and we hope to see you on a future webinar. Enjoy the rest of your day. Happy Monday, everyone. Bye-bye.